Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Noura Mustafa, lecturer of medical biochemistry. Today, inshallah, we are going to discuss vitamins. Our objectives today is to classify vitamins, discuss fat-soluble vitamins, their sources, functions, and deficiency, and also, lastly, to identify water-soluble vitamins, their sources, functions, and deficiencies. What are vitamins? Vitamins are organic nutrients which are required in very small amounts. They cannot be synthesized by the body and therefore must be supplied by the diet. They are essential for many chemical reactions, many biochemical reactions, which are very important in normal growth and development. Vitamins are not utilized in the structure of the cell and they don't provide energy, but they act as cofactors for enzymes. Absence or relative deficiency of the vitamins lead to deficiency states or diseases. So vitamins are required in small amounts. They cannot be synthesized by the body and therefore must be supplied by diet. They don't enter the structure of the cell and don't provide energy. Why are they important? Because they act as cofactors for enzymes and they are needed for many biochemical reactions needed for growth and development. Deficiency, either absence or relative, can lead to deficiency state or diseases. Vitamins. Vitamins are classified into two main categories: fat-soluble vitamins, which include A, D, E, and K, ADIC, and water-soluble vitamins, which include vitamin C and vitamin B complex. What are the main differences between water-soluble vitamins and fat-soluble vitamins? Both of them are absorbed in small intestine, but water-soluble vitamins don't need any bile or lipids for their absorption. So water-soluble vitamins, because they are water-soluble, they don't need bile or lipids for their absorption. On the other hand, the fat-soluble vitamins needs bile for absorption. They need bile for absorption. The water-soluble vitamins cannot be stored except for B12. B12 can be stored in very small amount, but the other water-soluble vitamins cannot be stored. And so any large amount, if ingested, will be excreted in urine. Any large amount will be excreted in urine. On the other hand, the fat-soluble vitamins can be stored in liver and other organs. And so if any large amount ingested, cannot be excreted through urine, so hypervitaminosis may occur. So again, if fat-soluble vitamins are ingested in large amount, they can be stored, but the remaining part will cause hypervitaminosis because the remaining part cannot be excreted through urine. But water-soluble vitamin, if ingested in large amount, they are excreted in urine. Any remaining amount can be excreted in urine. So deficiency manifestation in case of water-soluble vitamin will appear quickly because there is no stored amount of water-soluble vitamin. So if there is diet restriction, for example, and the vitamins are not ingested, the deficiency manifestation will appear quickly. While on the other hand, the fat-soluble vitamins, if diet restriction occur and the vitamins are not ingested, the deficiency manifestation will appear later because there is a stored amount of fat-soluble vitamins. So again, what are the main differences? They are both absorbed in a small intestine. The water-soluble don't need bile, the fat-soluble need bile for their absorption. As regards storage, the water-soluble vitamins are not stored except for B12. The fat-soluble are stored in liver and other organs. Excretion or removal, the water-soluble vitamin can be excreted through urine, so any large amount ingested will be excreted through urine, while fat-soluble vitamin, they are not excreted through urine, so if any large amount ingested will cause hypervitaminosis. Deficiency manifestation will appear quickly in case of water-soluble vitamin if diet restriction occur. This is because there is no stored amount of water-soluble vitamins, while in case of fat-soluble vitamin, the deficiency manifestation will appear later after diet restriction because there is a stored amount of fat-soluble vitamins. Now moving to the first fat-soluble vitamin, which is vitamin E. Vitamin E is called anti-xerophthalmic vitamin. Anti-xerophthalmic vitamin. Anti means that the deficiency of this vitamin A will cause this disease, which is called xerophthalmia. So this is the meaning of anti. Anti means the presence of this vitamin prevent this disease. So it's called anti-xerophthalmic. The presence of this vitamin prevent this disease. So it's called anti-xerophthalmic vitamin. Zero means dryness. Zero means dryness. Ophthalmic means eye. So dryness of the eye. The vitamin A is present in animal sources and also in plant sources. The vitamin A itself is present only in animal sources like liver, kidney, butter, egg yolk. Also, fish liver oil, the liver of fish, the oil extracted from liver of fish contain high concentration of vitamin A. For example, as cod liver oil. It contains high concentration of vitamin A, and by the way, contain also high concentration of vitamin D. Okay, so the fish liver oil as cod liver oil contain high concentration of vitamin A and also high concentration of vitamin D. This is as regard the animal sources. So vitamin A itself is present in animal sources only. But there is a compound called provitamin A. What's provitamin A? They are compounds that when ingested in diet will give or will be converted to vitamin A inside the body. So it's called provitamin A. So when ingested in diet, inside the body it will be converted to vitamin A, so it's called provitamin A. These compounds are called carotenes. Carotenes. So carotenes are provitamin A, which means they are compounds when ingested in diet will be converted inside the body to vitamin A. These carotenes are present in yellow and green vegetables like carrots, like tomatoes, like spinach, potato, lettuce. All these contain carotenes, which when ingested will be converted to vitamin A. Okay? Now moving to functions of vitamin A. The first and main function of vitamin A is vision. Vision. It's required for vision in low intensity light at night. Okay, so it's important for night vision. It's important for night vision. And also it's important for the healthy epithelium of the eye and normal secretion. It's important for the healthy epithelium of eye and normal secretion. And for this, it's called anti-xerophthalmia, because its deficiency will cause xerophthalmia, which means dryness of the eye. So it's important for night vision, this is the first function, and also it's important for healthy epithelium of the eye and normal secretions. In addition, it's important for normal growth, normal functions of the skin, mucous membranes, and bone tissue. It's important for normal functions of the skin, of the mucous membranes, and bone tissues. Vitamin A is essential for reproduction in both sexes. In male, for example, it's important for spermatogenesis, and in female is important for placental functions and fetal growth during pregnancy. So it's important for placental functions and fetal growth in pregnancy. The beta-carotene is an antioxidant. Carotene, as we mentioned, is provitamin A. This carotene is antioxidant. It has an antioxidant function. This is a very important function for vitamin A. Also, it has anti-cancer activity. It has anti-cancer activity. So it has antioxidant and anti-cancer. So vitamin E is important in vision, is essential for night vision. It's essential for normal epithelium of the eye and normal secretions. Vitamin E is essential for normal growth, normal integrity of the epithelium, mucous membranes, skin, bone. Also, an important function is reproduction, either in both sexes, in male and in female, both in both of them, spermatogenesis, fetal growth, and placental functions, to anti-cancer and antioxidant activity. Deficiency of vitamin A. As I mentioned, vitamin A is important for night vision. So, deficiency of vitamin A leads to night blindness or defective night vision. It's called night blindness. Vitamin A is important for growth and for integrity of the skin, mucous membrane, and bone. So it leads to failure of growth and impaired bone growth. Also, I mentioned that vitamin A is called anti-xerophthalmic vitamin. Anti means it prevents the occurrence of this disease, which is called xerophthalmia. Zero means dryness, and ophthalmia means eye, dryness of the eye. So its deficiency will lead to xerophthalmia, dryness of the eye. Also dryness or xerosis, which means dryness and keratinization of mucous membranes and infections. We mentioned that vitamin A is important for reproduction in both sexes. So its deficiency will lead to reproductive disorders as degeneration of the testes, abortion, production of malformed offspring. If excessive use of vitamin A supplements occur, vitamin A toxicity will occur. It's called hypervitaminosis A. Hypervitaminosis A. This occurs with excessive use of vitamin A supplements because excess vitamin A will not be excreted through urine. So chronic toxicity, if chronic toxicity occur, this will lead to hepatosplenomegaly and bone abnormalities. Hepatosplenomegaly and bone abnormalities. So vitamin A functions. Vitamin E is important for vision, as I mentioned. It's important for night vision and integrity of the epithelium of the eye and normal secretions. Also, it's important for normal growth, integrity of the skin, mucous membranes, and bone. It's important for reproduction in both sexes, in male spermatogenesis, and in female, it's important for placental functions and fetal growth. Also, two anti-functions, antioxidant and anti-cancer. So its deficiency will lead to defective night vision, failure of growth, xerosis and xerophthalmia, okay, impaired bone growth, and reproductive disorders may occur like abortion or malformed fetus or defective spermatogenesis. And now moving to the second fat-soluble vitamin, which is called vitamin D. Vitamin D is called anti-rachitic vitamin. Anti-rachitic vitamin means the vitamin which prevent the occurrence of rickets. Anti-rachitic means prevent the occurrence of rickets. Vitamin D is present in large concentration in cod liver oil, as I mentioned, or fish liver oil, which I mentioned before that it contains high concentration of both vitamin E and vitamin D. Vitamin D also is present in fatty fish, in liver, in egg yolk, but milk is poor in vitamin D. Milk is poor in vitamin D. Only powdered milk can be enriched with vitamin D. Powdered milk, which is used for child feeding, can be enriched with vitamin D. There is another source of vitamin D. When cholesterol is ingested in diet, it's converted in intestinal mucosa to 7-dehydrocholesterol. When cholesterol is ingested in diet by intestinal mucosa, it will be converted to 7-dehydrocholesterol. 7-dehydrocholesterol passes to skin, where under the effect of ultraviolet rays, it's converted into vitamin D3. Vitamin D3. It's called cholecalciferol. So vitamin D3 is called cholecalciferol. So again, when cholesterol is ingested in diet, it's converted by intestinal mucosa to 7-dehydrocholesterol, which passes to skin, and under the effect of ultraviolet rays, it's converted to cholecalciferol, which is called vitamin D3. Vitamin D3 must undergo activation through two steps in order to perform its function. So it must be activated in two steps and in two organs. The first step is in liver. Hydroxylation at carbon number 25. Hydroxylation occurs at carbon number 25. So 25 hydroxy vitamin D3 is produced. So the first step of hydroxylation occurs in liver by 25 hydroxylase enzyme, and so 25 hydroxy D3 is produced. The second hydroxylation reaction occurs in the kidney. This is the second step of activation. The second step occurs in the kidney by 1-hydroxylase, by enzyme called 1-hydroxylase. This is the second hydroxylation. So 1,25-dihydroxy D3 is produced. 1,25-dihydroxy D3 is produced, which is called calcitriol. So calcitriol is called 1,25-dihydroxy D3 or 1,25-dihydroxy cholecalciferol. This is called the calcitriol, and this is the active form of vitamin D, which will perform the functions of vitamin D. We have two forms of vitamin D, D2 and D3. D2 is present in plant sources and supplements. Also D3 is present in animal foods or animal sources and also supplements. Both of them are not biologically active. They must be converted to the active form of vitamin D in order to perform its action. The active form is called calcitriol, or 1,25-dihydroxy cholecalciferol, or 1,25-dihydroxy D3. So, as I mentioned, the vitamin D must be activated in two organs by two hydroxylation reactions in order to perform its function. The first hydroxylation occurs in the liver at carbon number 25 by 25 hydroxylase. And this results in the formation of 25-hydroxy-D3. 25-hydroxy-D3. The second step occurs in the kidney, second hydroxylation reaction at carbon number 1 by 1-hydroxylase enzyme, and this results in the formation of 125-dihydroxycholecalciferol or 125-dihydroxy-D3 or calcitriol, and this is the most active form of vitamin D which will perform its functions. Functions of vitamin D is to maintain adequate serum level of calcium. To maintain adequate serum level of calcium. This is to maintain normal calcium level, which is 9 to 11 milligram per deciliter. This function is performed by increase absorption of calcium by the intestine. Increase absorption of calcium by the intestine. Also, increased reabsorption of calcium by the kidney. Increased reabsorption of calcium by the kidney. So it acts on both intestine and the kidney to increase absorption and the reabsorption of calcium. As regards the third organ, it acts on bone. It acts on bone. If calcium level is normal, it increases bone mineralization. So it deposits calcium and phosphorus into bone, and this causes bone mineralization. But on the other hand, if calcium level is low, it leads to bone resorption. What's meant by bone resorption? Destruction of bone or destroying of bones in order to obtain calcium and phosphorus to be absorbed into the blood or to be released from bone to blood in order to maintain calcium and phosphorus level in the blood. So again, on intestine, it increases calcium absorption. On the kidney, it increases reabsorption of calcium and also phosphate, by the way. And as regards the bone, it increases bone mineralization if calcium level is normal. But if calcium level is low, it will increase bone resorption, which means destruction of bone in order to maintain calcium and phosphorus level in the blood. If vitamin D is deficient, it will lead to, in children, leads to rickets. So vitamin D deficiency in children leads to rickets, while in adult it causes osteomalacia. In children, it leads to rickets, which is manifested by delayed sitting, walking, teething, deformed bones, skull, chest, legs. But in adult, it's manifested by osteomalacia. Osteomalacia can be manifested by bone deformation, bone fracture. Osteomalacia is softening of bones and decreased bone density, so it's more liable for bone fracture. So this is vitamin D deficiency. For this, it's called anti-ricketic vitamin because it prevents the occurrence of rickets. So vitamin D deficiency in children leads to rickets and in adults leads to osteomalacia. If vitamin D is ingested in too excessive amounts, it can lead to hypercalcemia and the calcification of soft tissues, for example, in the kidney or arteries. Also in children, it may retard linear growth in children. So vitamin D toxicity can lead to calcification and hypercalcemia, and deposition of calcium in arteries or in kidney may lead to kidney stones, and in children it can retard linear growth. And now the third vitamin, fat-soluble vitamin, is called vitamin E. Its chemical name is called tocopherol, and also anti-sterility vitamin because it has role in reproduction. The plant oils like wheat germ oil, sunflower oil, and also nuts like almonds, hazelnuts, all these are very rich sources of vitamin E. Also, green leafy vegetables like spinach, for example, also is rich in vitamin E. Functions of vitamin E, it's the most important natural antioxidant. So this is the second vitamin which is also antioxidant or has antioxidant activity. The first one was vitamin A. Okay, so this is the second one and it's the most important natural antioxidant. The third one will be C. So A, C, and E are antioxidant vitamins. So vitamin E is the most important natural antioxidant. Okay, it's the first defense mechanism against peroxidation of phospholipids. These phospholipids are present in cellular membranes. So it protects against peroxidation of these phospholipids. If these phospholipids are oxidized, it may lead to rupture of cell membranes, and hemolysis, for example, in RBCs. Okay, so it protects the first defense mechanism against peroxidation of phospholipids of cellular membranes, and so it protects the RBCs from toxic hemolysis. Also, it has role in reproduction. For this, it's called anti-sterility vitamin and has role in aging. So again, vitamin E is the most important natural antioxidant. It protects against the peroxidation of phospholipids which are present in cellular membranes. For this, it protects the RBCs, for example, from toxic hemolysis. It protects many tissues from the effect of free radicals, because it's a very important or a very potent antioxidant. So it protects many tissues against the dangerous effects of free radicals. It protects the RBCs from toxic hemolysis in addition to its role in reproduction and aging. And so, deficiency of vitamin E leads to anemia. Anemia, this is due to hemolysis of RBCs because it leads to BUFA oxidation. BUFA, polyunsaturated fatty acid, which is present in the phospholipids. Polyunsaturated fatty acids, which are present in phospholipids, present in cellular membranes, okay? And if oxidation occurs, this will lead to toxic hemolysis of RBCs and anemia occurs. As we mentioned, vitamin E is a very potent antioxidant, so its deficiency leads to muscle dystrophy, neurological disorders, impairment of immune response. Muscle dystrophy, neurological disorders, and impairment of immune response. Lastly, it has a role in reproduction, so its deficiency leads to reproductive disorders. So deficiency of vitamin E leads to anemia, which is due to hemolysis. This is the first vitamin whose deficiency leads to anemia. Also, it leads to muscle dystrophy, neurological disorders, and impairment of immune response. This is due to antioxidant activity. Also, it's an anti-sterility vitamin, so its deficiency leads to reproductive disorders. Now moving to the last fat-soluble vitamin, which is vitamin E. It's called anti-hemorrhagic vitamin. As we mentioned, anti means prevent the occurrence of, so it prevents the occurrence of hemorrhage. Vitamin K is present in fresh dark green leafy vegetable like spinach, for example. This is the first form, which is called vitamin K1. There is another form of vitamin K which is called K2. K2 can be synthesized by intestinal flora inside our intestine. So we have two forms. The first one, K1, which is present in green leafy vegetable like cabbage, cauliflower, broccoli. All these contain K1, while K2 can be synthesized by intestinal flora inside our body. Functions of vitamin K, it's important for synthesis of clotting factors. Clotting factors synthesized by vitamin K is clotting factor 2, clotting factor 7, clotting factor 9, and lastly clotting factor 10. So it's important for synthesis of clotting factor 2, 7, 9, and 10. 2, 7, 9, and 10. It can be grouped into 1972. Okay. The second function is important. This is the first function, synthesis of these clotting factors, 1972, and also activation of blood clotting factors and synthesis of some bone proteins. So the first one is synthesis of clotting factors, 1972, activation of clotting factors, and synthesis of some bone proteins. So deficiency of vitamin K will lead to these clotting factors will not be synthesized. The most important of them is the second one, which is called prothrombin, clotting factor 2. Clotting factor 2 is called prothrombin. Prothrombin level, if decreases in blood, this will lead to prolonged clotting time, and this will increase bleeding tendency. So manifestation of vitamin K deficiency, decrease the prothrombin level in blood. Prothrombin is clotting factor 2. This will lead to prolonged clotting time and increased bleeding tendency. So it leads to hemorrhage, especially in the newborn, and prolonged prothrombin time. So manifestation, hemorrhage in the newborn and prolonged prothrombin time. Why are the newborn susceptible or more susceptible for vitamin K deficiency? Because they have no intestinal flora or no intestinal bacteria. So deficiency may occur in newborn because the intestinal bacteria are not yet formed. Liver disease, because the liver is the organ which helps the absorption of fat, and vitamin K is fat soluble vitamin, so liver disease will lead to decreased absorption of fat. And lastly, prolonged use of antibiotic because this kills the intestinal flora in the intestine. Okay, so vitamin K deficiency may occur in newborn because due to absence of intestinal bacteria, also prolonged use of antibiotic due to killing of intestinal bacteria, and liver disease due to decreased absorption of fat. And vitamin K, as we said, is one of fat soluble vitamin. This will lead to prolonged prothrombin time and hemorrhage, especially in the newborn. So, as we mentioned, vitamin A is important in vision, in night vision, and healthy epithelium of the eye and normal secretions, normal growth and integrity of the skin mucous membrane and bone, reproduction in both sexes, antioxidant and anti-cancer. So, its deficiency will lead to defective night vision or night blindness. It will lead to cirrhosis and xerophthalmia, keratinization, impaired bone growth. It also leads to reproductive disorders as abortion and production of malformed offspring, degeneration of the testes. Vitamin D is important to maintain adequate serum calcium level by increasing absorption of calcium by the intestine, increasing reabsorption of calcium through the kidneys, and increase bone mineralization if calcium level is normal. But in case calcium level is low, it will lead to bone resorption, softening of bones, and release of calcium and phosphorus into the blood in order to maintain their levels. So the deficiency of vitamin D will lead to rickets in children, while in adults it leads to osteomalacia. Vitamin E is the most important antioxidant. It's the first defense mechanism against peroxidation of phospholipids in the cell membranes. It protects the RBCs from hemolysis, and it has role in reproduction and in aging. So its deficiency leads to anemia due to BUFA oxidation or polyunsaturated fatty acid present in the phospholipids in cell membranes, muscle dystrophy and neurological disorders, and the impairment of immune response. This is due to its antioxidant activity. And lastly, reproductive disorders. Vitamin K is important for the synthesis of clotting factors 2, 7, 9, and 10, grouped as 1972, activation of blood clotting factors, and synthesis of some bone proteins. Deficiency of vitamin K will lead to hemorrhage, especially in the newborn, where no intestinal flora is present, and prolonged prothrombin time, which is due to increased bleeding tendency because the prothrombin is clotting factor number 2. Now moving to water-soluble vitamins. Water-soluble vitamins include vitamin C and vitamin B complex. Let's begin with vitamin C. Vitamin C, which is called also ascorbic acid, is present in citrus fruits, guava, green vegetables, cabbage, cauliflower, tomatoes, pepper. The function of vitamin C is antioxidant. So now we have mentioned the 3 antioxidant vitamins: vitamin A, vitamin E, and vitamin C. A, C, E. Antioxidant vitamins. Also, it's important for biosynthesis of collagen, which is present in the skin and mucous membranes, biosynthesis of steroid hormones present in adrenal glands, absorption, transport, and storage of iron, and activation of folic acid. So the first function is antioxidant, the second and third biosynthesis of collagen and steroid hormones, and number 4 and 5 Fe and folic acid, 2F, Fe and folic acid, Fe iron, absorption, transport, and storage, and also for activation of folic acid. Deficiency of vitamin C leads to disease called scurvy. So vitamin C is sometimes called anti-scurvy vitamin. Its deficiency leads to scurvy, which is due to defective collagen synthesis. As I mentioned, collagen is present in the skin, connective tissue. So these are the manifestations of scurvy: soft swollen gums, loose teeth, bleeding tendency, subcutaneous hemorrhage, joints, swollen joints and muscle weakness, delayed wound healing. So there is delayed wound healing. This is a skin manifestation. Subcutaneous hemorrhage and bleeding tendency. These are skin manifestations. Joint, muscle, so swollen joints, muscle weakness, and teeth and gums, loose teeth and soft swollen gums. So there are skin manifestations: bleeding tendency, subcutaneous hemorrhage, delayed wound healing, gums and teeth, swollen gums, loose teeth, and joint and muscle weakness, and joint are swollen joints. The second manifestation is iron deficiency anemia. This is due to impaired utilization of iron. As I mentioned, vitamin C is important for utilization of iron, absorption, transport, and storage. Now moving to vitamin B complex. So we have mentioned the functions of vitamin C. antioxidant vitamin, biosynthesis of steroids and biosynthesis of collagen in skin and mucous membrane, Fe and folic, iron utilization, storage, absorption, and transport, and activation of folic acid. So its deficiency lead to scurvy and iron deficiency anemia. So iron deficiency anemia. So now this is the second vitamin whose deficiency leads to anemia. The first vitamin was vitamin E. It leads to hemolysis or due to anemia due to hemolysis. And now this is the second type of anemia, iron deficiency anemia. This is the second vitamin, vitamin E and vitamin C. Both of them, their deficiency leads to anemia. And also we mentioned antioxidant vitamin, vitamin A, vitamin C, and vitamin E. Now moving to vitamin B complex, general functions of vitamin B complex, they act as coenzymes which act in metabolic pathways of proteins, carbohydrates, and lipids. So they act as coenzyme in different metabolic pathways of the whole metabolism of protein, carbohydrates, and lipids. This is a general function of vitamin B. Beginning with vitamin B1, which is called anti-beriberi. Anti-beriberi means a vitamin which prevent the occurrence. Anti means prevent the occurrence of beriberi, disease called beriberi. By B1, vitamin B1, all members of vitamin, all components of vitamin B complex are usually present in whole grains, together with the grain, together with the peel. Okay, so whole grains, also present in nuts, vegetables, cereals, and of course animal diet like meat and eggs. The B1 vitamin has very important function because it acts as coenzyme in carbohydrate metabolism. It acts as a coenzyme in carbohydrate metabolism. Deficiency of vitamin P1 causes disease called beriberi. This is prevalent in China and Japan, where the rice is the basic diet and there is over polishing of cereals, so there is removal of the peel. Vitamin B is present in the peel, so there will be deficiency of vitamin B1. We have two types of beriberi, dry and wet. Dry, this is characterized by dry skin because there is affection of the nervous system. So it's characterized by anorexia, vomiting, exhaustion, polyneuritis, paralysis, and dry skin. So due to presence of dry skin, it was called dry beriberi. Wet beriberi affect the cardiovascular system, and for this, edema is present. Edema, dyspnea, palpitation, congestive heart failure, so there is affection of cardiovascular system. So types of beriberi, we have dry and wet. Dry characterized by dry skin and affection of the nervous system, while wet affect the cardiovascular system. There is edema, dyspnea, and affection of the heart. This was beriberi, anti-beriberi vitamin, which is called vitamin B1. Moving to the second vitamin, which is called riboflavin or B2. B2 is present also, as we mentioned, all of them are present in liver, egg, meat, whole grains, green vegetables. B2 enter in the structure of fat. It's called riboflavin, so it enters in the structure of fat and FMN. Both of them act as coenzymes in oxidation and in metabolism in general. So it enters in the formation of two coenzymes, fat and FMN, which act as coenzyme in the oxidation and metabolism. Deficiency of vitamin B2 leads to a riboflavinosis. B2 is called riboflavin, so its deficiency leads to a disease called a riboflavinosis, which is manifested by angular stomatitis. Angular means at the angle, stomatitis. Itis means inflammation. Stoma means mouth, so it's inflammation of the mouth. Angular, angles of the mouth, so it's inflammation around the angles of the mouth. Dermatitis, inflammation. Itis means inflammation. Derma, skin, so inflammation of the skin around the nose, ears, and eyes. Lacrimation and photophobia, also affection of the eye. So this is a riboflavinosis manifested by angular stomatitis, inflammation of the angles of the mouth, also lacrimation and photophobia, dermatitis, inflammation around the nose, eyes, and ears. These all are called a riboflavinosis. This is B2. Moving to B3. B3 is called niacin or nicotinic acid. Niacin or nicotinic acid, also present in meat, cereals, nuts, yeast. B3 can be synthesized by intestinal flora. B3 can be synthesized by intestinal flora from an amino acid called tryptophan. So it can be synthesized by an amino acid called tryptophan. 60 mg tryptophan can synthesize 1 mg niacin or nicotinic acid. So it can be synthesized by intestinal flora from tryptophan. Niacin enters in the structure of NAD and NADP. So we mentioned before that B2, which is called riboflavin, enter in the structure of fat and FMN. Now B3 enter in the structure of NAD and NADP, which also act as a coenzyme in metabolism. Deficiency of niacin leads to pellagra. Pellagra is characterized by 3 Ds: dermatitis, diarrhea, and dementia. Dermatitis, itis means inflammation, derma skin, so inflammation of the skin. Diarrhea and dementia. Dementia means affection of the brain functions, affection of the cognitive and brain functions. So niacin or pellagra is characterized by dermatitis, diarrhea, and dementia. So now we have finished B1, B2, and B3. B1 deficiency leads to beriberi. B2 deficiency leads to riboflavinosis. B3 deficiency leads to pellagra, 3D, diarrhea, dermatitis, and dementia. B6 is called pyridoxine. Pyridoxine, also present in liver, meat, nuts, yeast. It acts as a coenzyme in amino acid metabolism. It acts as a coenzyme in amino acid metabolism. Also, a very important function, it shares in heme metabolism. So it acts as coenzyme for amino acid in amino acid metabolism, and also a very important function in heme metabolism. So its deficiency, B6 deficiency, leads to, it's very important in heme metabolism, so it leads to anemia. Anemia due to impaired hemoglobin formation. Anemia. Also, we mentioned that it's coenzyme in amino acid metabolism, so there is affection of growth, impaired growth, neurologic disorders, convulsion, depression, mental confusion, nausea and vomiting of early pregnancy. Its deficiency leads to nausea and vomiting of early pregnancy, and lastly, it leads to pellagra. It leads to pellagra because this vitamin, which is called B6, help the transformation of tryptophan to vitamin B3. Helps the transformation of tryptophan to vitamin B3. So if there is B6 deficiency, there will be deficiency of B3 also, which is synthesized by intestinal flora from tryptophan. So B6 deficiency, which helps the transformation of tryptophan to vitamin B3, leads to deficiency of B3. So this will lead to pellagra, which is characterized by 3 Ds, dementia, diarrhea, and dermatitis. So B6 leads to impaired growth, leads to anemia, neurologic disorders, nausea and vomiting, neurologic and nausea and vomiting, so there is 2N, neurologic disorders, nausea and vomiting of pregnancy, pellagra due to B3 deficiency. The first one was anemia and impaired growth. Anemia is very important. So, anemia due to impaired hemoglobin formation, because vitamin B6 is important in heme metabolism. Now we have mentioned this is the third vitamin whose deficiency leads to anemia. We mentioned before vitamin E, and the second one was C, and now the third one is vitamin B6. B6 is the third vitamin whose deficiency leads to anemia. Moving to folic acid. Folic acid is present in liver, kidneys, meat, green leafy vegetable, nuts, whole grains. Folic acid has two important functions. The first function is nucleic acid synthesis. This is very important function. It's important for nucleic acid synthesis and cell division. And the second one is RBC's formation in the bone marrow. So it has two important functions, nucleic acid synthesis and cell division, and the second one, RBC's formation. So its deficiency leads to, since it's important information of RBCs, so its deficiency will lead to anemia. The type of anemia is called megaloblastic or macrocytic. The RBCs are larger in size due to inhibition of DNA synthesis. Okay, so due to inhibition of DNA synthesis that require folic acid, the RBCs produced is called megaloblastic or macrocytic anemia. The second manifestation is neural tube defect. Since the folic acid is important for nucleic acid synthesis and cell division, Okay, so this is a very important in the nervous system. This will lead to neural tube defect, especially in the fetus. For this, during the first trimester of pregnancy, folic acid is very important to be ingested for pregnant women. So they should ingest folic acid because this is very important, because during the first trimester, the nervous system of the fetus is developing. So folic acid must be ingested. Its deficiency or deficiency of folic acid can lead to neural tube defect in the fetus. So function of folic acid is nucleic acid biosynthesis, cell division, formation of RBCs in the bone marrow. So deficiency will lead to megaloblastic or macrocytic anemia, and the second one is neural tube defect in the fetus. And now moving to vitamin B12 cobalamin, which is the last member of vitamin B complex we will discuss today. Vitamin B12 is called cobalamin. Cobalamin, vitamin B12 is present, is the only vitamin which is present in animal food only. Only vitamin B which is present in animal food only. Only animal food. So vegans are susceptible for vitamin B12 deficiency. It's present in liver, kidney, meat, and fish. Vitamin B12 is also important for synthesis of nucleoproteins. Nucleoproteins, so it's important for synthesis of nucleic acid as folic acid. Also formation of RBCs in the bone marrow. The second function also as folic acid, and also metabolism of the nervous system. So again, the same function as folic acid, metabolism of nervous system, normal formation of RBCs, and synthesis of nucleoproteins or nucleic acid. Its deficiency leads to affection of RBCs, megaloblastic anemia, and affection of the nervous system, neuropathy, megaloblastic anemia, and neuropathy. So, as we mentioned, the functions of vitamin B12, it is important for synthesis of nucleoproteins, nucleic acids, synthesis of nucleoproteins, nucleic acids, and functions of the nervous system, and also formation of red blood cells or formation of RBCs in the bone marrow. So, to sum up vitamin B complex, first, vitamin B1 is called thiamine. It functions as a coenzyme in carbohydrate metabolism. Its deficiency leads to beriberi. Dry beriberi affects the nervous system. Dry skin, manifested by dry skin, and also polyneuritis and paralysis. This is affection of the nervous system. Wet beriberi, wet, so it reminds me of edema. So there is affection of cardiovascular system, so dyspnea, palpitation, congestive heart failure. Vitamin B2, riboflavin, it enters in the structure of FAD and FMN, while B3, nicotinic acid, enter in the structure of NAD and NADP. Okay, both of them or all of them, FAD, FMN, NAD, and NADP, all of them are coenzymes in metabolism. Riboflavin B2 deficiency leads to ariboflavinosis, which is manifested by angular stomatitis, inflammation around the angles of the mouth, dermatitis, inflammation of the skin around the nose, ears, and eyes, lacrimation, and photophobia. Vitamin B3, which is called nicotinic acid deficiency, leads to pellagra. Pellagra is manifested by 3Ds, dermatitis, dementia, and diarrhea. Dementia is affection of the cognitive or the brain functions. Dermatitis, inflammation of the skin. B6 deficiency, B6 pyridoxine acts as a coenzyme in amino acid metabolism and also in heme metabolism. So it's very important in heme, so its deficiency leads to anemia due to impaired hemoglobin formation, impaired growth, also neurologic disorders, nausea and vomiting of early pregnancy, and lastly, pellagra. Folic acid is important in nucleic acid synthesis, cell division, RBCs formation. So it leads its deficiency, since it's important in RBCs formation, so it leads to megaloblastic or macrocytic anemia. It's important for nucleic acid synthesis, so it leads to neural tube defect in the fetus. So folic acid supplements should be ingested during the first trimester of pregnancy. B2 cobalamin is important also for synthesis of nucleic acids, formation of RBCs, and the metabolism of nervous system. So its deficiency will lead also to megaloblastic anemia and neuropathy. Apathy means disease affecting neuro, means affection of the nervous system. So these are the components of vitamin B complex. Antioxidant vitamins, we mentioned before, antioxidant vitamins include vitamin A, vitamin C, and vitamin E. Also, we mentioned vitamins whose deficiency leads to anemia. We mentioned before vitamin E due to BOFA oxidation or polyunsaturated fatty acid oxidation in the phospholipids of the cell membrane. So the first vitamin whose deficiency leads to anemia is vitamin E, leads to hemolytic anemia. Vitamin C leads to iron deficiency anemia. This is due to impaired utilization of iron. Here in vitamin B complex, we mentioned vitamin B6 leads to anemia due to impaired hemoglobin formation. Also, we have folic acid and vitamin B12 leads to megaloblastic anemia. So, vitamin E, vitamin C, vitamin B6, folic acid, and vitamin B12, all of these leads to anemia. Also, if we say a question, for example, vitamins whose deficiency leads to skin manifestation. Vitamins whose deficiency lead to skin manifestations. At first, vitamin A is important for the integrity of epithelium, mucous membrane. It is called anti-xerophthalmic vitamin. So, vitamin A, this is the first one. Vitamin C also, whose deficiency lead to scurvy. This is very important. Vitamin C is important for the biosynthesis of collagen, which is present in skin and the mucous membranes. So vitamin C. So at first vitamin A, vitamin C among the vitamins whose deficiency lead to skin manifestation. Here we have vitamin B1. There is edema, so it's an affection of the skin. Dermatitis in B2, so B2 also leads to skin manifestation. Dermatitis also among the pellagra manifestation in B3, and also pellagra present in vitamin B6 deficiency. So there is dermatitis in vitamin B1 deficiency, in B2 deficiency, B3 deficiency, and B6 deficiency. Dermatitis in B2, dermatitis in B3 deficiency, and also in pellagra manifestations in B6 deficiency. Edema in B1 deficiency. So the vitamins whose deficiency lead to skin manifestation include vitamin A, vitamin C, vitamin B1, B2, B3, and B6. Also, we have mentioned among the fat-soluble vitamins, vitamin E. Vitamin E, we mentioned that it has very important antioxidant activity. Important for supporting the function of the immune system, for the cell function, for the skin health. So it's important for the skin health due to its antioxidant activity. It combats the effect of the free radicals produced by either the metabolism of food and also the environment. So it's important for maintaining the skin health. So a deficiency of vitamin E will lead also to skin manifestation. So at last, the vitamins whose deficiency lead to skin manifestation include vitamin A, vitamin C, vitamin E, vitamin B1, B2, B3, and B6. Hope you understand our lecture today. Thank you.